That brings us to your weekly capsule of health information. We like to call it your healthy dose. And today we're talking about interventional pain. And here to tell us a little bit more is Dr. Luvell Glanton. Good morning, doctor.
Good morning. How are you doing?
Pain-free.
That's excellent. That's the way to be.
3 months ago, if I would have said that, I would have said, "Ooh, I'm a hurting unit." But this is kind of interesting, interventional pain. So what is it that you do?
So basically, we try to find an injection or a procedure to treat pretty much any type of pain you have, whether it's a joint, whether it's coming from your back. We do pretty much all joints, back, muscle pain, so musculoskeletal pain-related things. That's basically what we treat. So let's say if you have like a chronic back issue that has not resolved with physical therapy or has not resolved with medication management, such as NSAIDs like ibuprofen, Tylenol, things of that nature, then you would see an interventional pain specialist where you may get an epidural steroid injection or spinal cord stimulator or something of that nature.
Interesting.
What does interventional mean? What in your practice, what would that stand for?
So interventional is the procedure side of the practice, basically. So you do a procedure to intervene for whatever the pain source is. So let's say, again, my favorite is like neck and back pain. So let's say you have a car accident and you have continued neck pain after a whiplash injury. You've seen physical therapy or you've seen a chiropractor, but the pain hasn't resolved. There's a way that we can go in and inject the facet joints or the joints that are part of the cervical spine to give you pain relief. So it's like the interventional portion of that is it's not quite going to an open surgery, but it's not pain pills.
It's more of a block.
More of a block, yes.
Okay.
Staving off surgery that may eventually be required?
Yes.
Okay.
And sometimes we can stave off surgery and you no longer have to have the surgery with certain procedures. Or if you're not a surgical candidate, let's say you have, in our older patients, you have spinal stenosis or something of that nature, and you're not a candidate for surgery, then we could do something called a spinal cord stimulator, which basically we place that in the epidural space, which is a space in your back to block the pain from reaching your brain, because if you don't perceive the pain, you don't have the pain. So,
which is something that you do during childbirth, basically, is same area.
Same area as the epidurals that ladies get during childbirth. Yes, but with this, we're actually placing a device, almost like a pacemaker, into the back that sends signals to block pain from making it, let's say, from your legs to your brain.
Do you find that when people have a block, when they have this interventional pain treatment, do they end up healing it sometimes? Or do they end up having more pain sometimes, or more injury, should I say?
Well, normally, let's take a herniated disc, for instance. Herniated disc will normally heal on its own. And what we try to do with interventional pain is to relieve the pain while your body heals itself. So the injections don't actually heal the pain, but they mask the pain until your body can do the job itself.
So they may allow time for the healing.
Exactly.
Okay, to get through the process.
Yes.
Okay.
Interesting. Why is it so important to be very choosy about your physician?
Well, I think you have to find someone who gives comprehensive care, compassionate care, and who is committed to the community and the patient. Sometimes it can be a long road with pain management, and you don't want to go to someone who only does 1 or 2 therapies, who's only interested in taking you to the most advanced therapies. You want to start at the minimally invasive things. So what, like an epidural steroid injection, and work your way up to more invasive things like a spinal cord stimulator or an intrathecal pump. You want someone who doesn't only do only do interventions, but will also use adjuvant therapies, medication management, physical therapy, and who has ties to the community with other physicians, your spine surgeon, because you may need a spine surgeon, the physical therapy people. You want someone who has a comprehensive network.
All right.
Is there a way for a prospective patient to get a referral maybe from a pain physician or from the patients that have been previously treated?
Yes, you can definitely ask around to see who other people have seen. Also, you can ask your primary care doctor for a referral to a pain physician.
Okay. If you're needing that, especially like for insurance purposes and things like that.
Right, and you can self-refer as well, though.
That's good to know. All right. So, in addition to, say, for example, tramadol,
Yes.
to kind of numb the pain or stay, keep the pain down.
Yes.
This is an alternate treatment,
Well, it's
or does it supplement?
it's a supplement. It's
Okay.
kind of part of the continuum. So let's say that you had again, we'll take a back or a neck injury, and you were started on tramadol, and maybe you also went to physical therapy. Well, those things didn't help. And we did x-rays, didn't really show anything, did an MRI, and you have degenerative disc disease or something's wrong with your back. You may need additional treatments such as the epidural, such as spinal cord stimulation to help with that.
Okay. All right. It's kind of interesting to know that this is available, not because not everybody can do this. Is that a correct assumption? Okay. All right. So, if we want more information, do we need to come see you, or do we ask our physician?
Both. I take self-referrals as well as physician referrals.
Okay.
Okay, so when we're talking about referrals, you're talking about a patient could be able to come to you without having a doctor's
Exactly.
order
They
to do
call
that.
they call the office and set up an appointment, and we'll send out paperwork to help them along.
For us to be treated by you, for example, do we need to probably have gone through some sort of physical therapy? Are you kind of like the last resort?
Well, no, not the last resort. So, anytime you have pain that lasts outside of the norm, so you injure your back, it's been 2 or 3 weeks, you tried Tylenol or ibuprofen, it's a perfect time to go to the pain physician.
Okay.
At that point, I then orchestrate what treatment you need, whether it's physical therapy, whether it's more time, or whether it's one of these interventional therapies that you may need.
Okay. Interesting. Well, it's amazing. You weren't around 20 years ago, were you?
No.
But it's interesting. No, it is available. Interventional pain physician, Dr. Luvell Glanton. We appreciate your time this morning. Some interesting information. And Dr. Glanton, by the way, is with the Hannibal Regional Medical Group. But if you'd like more information, you can go to the website, even hrhonline.org, for more information. Doctor, thank you very much.
Thank you.
That's going to do it for this edition of Healthy Dose. It is brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group.